Mrs. Smith, a 50-year-old, is a new patient to your practice. She is attending today for a scale and clean as her previous dentist of 20 years has recently retired. Her medical history is clear. There's a family history of early tooth loss. She smokes about 10 cigarettes a day. Mrs. Smith has brought along an OPG taken at her last dental appointment when she had her 4/8 extracted. Today, you have performed a full periodontal examination and found heavy plaque and calculus deposits with some bleeding on probing at deeper sites, and you record generalized probing depth of 4 to 6 mm and a recession of up to 2 mm on the lower anterior teeth. Address patient's concerns, explain your diagnosis to Mrs. Smith, and work towards gaining informed consent for your management plan.
The pointers here would be that we focus on the diagnosis and explain pathophysiology. Explain the importance of risk factors, especially smoking. We must address management and concerns in a stepwise approach. Let's go into the role play now. Hello, Mrs. Smith. I hope you're feeling okay so far.
Yes, thank you.
That's good. I'll sit you up and we'll have a discussion about what we've seen so far. Is that okay?
Yes. Okay.
All right. So let me explain to you what I've seen today. I have gone over with my instrument, if you remember, when I was checking for some pockets. Pockets are basically gaps that get created between the teeth and the gums. So today I was recording almost up to 6 mm on a certain teeth, especially in your upper and lower back teeth region. So this has led to the diagnosis of periodontitis, which means it's advanced gum disease.
Okay. That's serious.
Yes, it is a little bit concerning because we must discuss about why this has happened and how we will now manage at this point.
Okay.
So you are sitting at a level where it is almost moderate to severe periodontitis, and which can also be classified as a grade 2 periodontitis. So we must really now dig deeper to find out what has led to this and also what are our next steps.
Okay.
All right. So before we discuss about what we'll be doing today, I do want to just recap a few questions with regards to your past dental visits. You did say that you've been seeing this dentist for a while, isn't it?
Yes, I've seen him for almost 20 years and he just recently retired. I would mostly just get some scale and clean done. I visited him about once or twice a year and did whatever he suggested, maybe whatever fillings he asked or whatever tooth removal, we just go ahead with it.
All right. I would love to have some notes transferred to our practice if that's possible.
I can definitely request the clinic where he worked. I'm not too sure.
Right. Okay. Yeah, it's just so that we'll have a record of what was done in the past as well. Now, when you said you had teeth removed, do you know why they were taken out?
I think they were loose.
All right. Okay. Is that something you were always noticing, that your teeth moving around or having that sort of looseness in any of those teeth?
Not really. I would just, brush and all that and go and get it professionally cleaned. And if he ever found something at that time, then we would go ahead and treat that.
Okay. Sounds like that was a good plan. Yeah. That's pretty good. Now, I know you said you're medically fit and well, but I just wanted to know, have you seen your GP anytime in the past?
Not recent past. I only see him if I'm in trouble or if I've gotten, a fever or something like that.
Okay. Does that mean that your blood tests are not up to date?
I haven't gotten it done for probably 8 months now.
Okay, so that's something that I think I would definitely encourage you to do.
Okay.
Once we finish with our appointment today. It's just very important that we stay on top of it because sometimes conditions like diabetes can also lead to this sort of advanced gum disease. We don't want to miss any findings at this stage. So definitely encourage you to go back and see your doctor.
Yes, this is starting to sound more serious than a regular dental checkup.
Let me assure you that we will definitely try to stay on top of everything.
Okay.
And it's good that you're here now and, we have all these findings to you. So we'll definitely chalk out a good plan and just make sure that we manage in this as effectively as possible. Okay. Now, I also do want to know about what sort of a family history do you have when we're talking about early tooth loss? Is there a history in your family with your parents or anyone else who's probably suffered from similar conditions?
I don't know about others, but yes, my parents did lose their teeth early. I'm not sure what exact age, but yes, I did seem to remember them having troubles with eating hard food and they had to lose their teeth.
All right. Okay. So just to be clear, sometimes you could be doing everything right, and there could be a genetic factor which also leads to advanced gum disease. So it's a good idea to always have a record of these things as well, because genetics do differently play a role in our bodies and the way we develop and manage diseases.
Okay, they're just a phone call away. I can always ask them for an exact history and let you know.
Absolutely. That's all good. Now, I do notice that you mentioned in your medical history form that you smoke about 10 cigarettes a day. Is that right?
Of course, I mean, it's such a stressful era of life, and that's just something that gives me some relief.
I understand. Yes. Have you tried speaking with someone in this regard? Have you tried to quit smoking or cut down on smoking in the past?
No, it just helps me, go through the day. I don't think I'm looking at something like that. So I haven't spoken to anybody.
Okay. So the reason why I'd like to pay your notice to this is smoking is also a huge risk factor when it comes to gums and gum health, and it can certainly predispose you to developing gum disease and advanced gum disease at this level. So it would be really good if you could consider cutting down on smoking and eventually quit if that's a possibility. And I'm here to help you. I can always give you resources. I can always refer you to the smoking quit line smoking number, where you can have a chat with them and discuss what options you have and how you can manage this better. Is that something you would want to have a think about?
Yeah, okay, I'll think about it. No guarantees.
Sure.
But
Yeah,
I'll think
yeah.
about it.
I understand, and as with anything else in life, it does take a few tries. So but it's always one step closer to eliminating risk factors when we work on reducing the smoking habit.
Okay.
Okay. Now, I know that you brought this big X-ray with you today, and it's good that I get a good picture of all the other teeth and the bone levels. But do you happen to know when was this done?
Yes, at my last visit, I think about 8 months back.
Yeah, 8 months ago. So that's not too bad. It's pretty much recent. So that's good, and we'll keep this for our records as well. But this is also useful for our future reviews as well. This would be a good baseline.
Okay.
So thank you for bringing that in today.
Okay.
Okay. Now we will now discuss about what will be done today. So the first step would be that I will give a very good, thorough, deep clean of all the areas that we have seen today, especially because I've taken some pictures to show you. If you just look around this side, you'll see that you've got a lot of deposits, which is now built up around those teeth. So we do need to clear all of that out. So I'll give all of that a good, deep clean today, and then I will discuss about your oral hygiene practices. Do you use a regular toothbrush, or what sort of routine do you follow at home?
My previous dentist asked me to start using electric toothbrush because it'll help with cleaning.
That's fantastic.
Yeah, every time I went to him, he said that I'm still having some deposits. So I've switched to it for about, probably a year now.
Okay.
And I do brush 2 times a day. I floss, because I like staying healthy. Like I told you, I'm quite fit, so I didn't want to lack in my oral hygiene.
That's great. Sounds like you're doing all the right things. I'll definitely go through the process of brushing and flossing again, and just make sure that, we are staying on top of the technique as well. But after today's treatment, after I've given you a deep clean, I would also want you to see a specialist, a gum specialist. So I'll give you a referral for that as well today.
Is it that serious?
It's best that we get a second opinion and management from a specialist as well. The size of the pockets and the amount of deposits, and also, you do have a little bit of a family history and risk factors such as smoking. So it's a good idea to always have a fresh set of eyes,
Okay.
have a look as well. And the specialist will correspond with us once he's seen you and he's treated you, and will bring you back into our rooms again in 3 months' time for a review. Does that sound like a plan?
Yes. Okay.
That's great. And the other thing I would do is definitely remind you to go and see your GP again. Just as we discussed earlier, I don't want to miss any other findings. Just
Okay,
because
okay.
that would
Yeah.
worsen the
I
situation.
will see him, yes.
Yeah. Do you have any other questions for me, Mrs. Smith?
I just hope that, whatever I'm doing gets a more of a benefit than,
Absolutely, yeah, and I completely understand your concerns. And sometimes I know that it can be a bit too much to take in as well. But I assure you that we are here to help you, and we will do our best to stabilize this condition for you. All right.
Thank you.
Should we go ahead and start with the treatment?
Sure.
All right.